and that the hospitals and the healthcare facilities should not themselves become amplifiers of the disease itself. Next slide, please. So when we really talk about risk communication, it had to be dealt with at 3 levels. And what we understand is that there needed to be very quick and accurate dissemination of the information as the public health event was unfolding, what we known as called the health emergency communication. But there was also a need for a lot of operational communication. So many agencies, line ministries, public health authorities needed to work in tandem, in close coordination, and to ensure a smooth chain of command and coordination, there needed to be timely exchange of information also amongst these authorities, the decision makers, the strategic core groups that were meeting at in all states at different levels, but also a lot of focus on behavior change communication, because we know that that was what would lead to tangible effects being seen in terms of preventing further disease transmission and making sure that the hotspots could be managed. And this obviously called for a lot of social mobilization, engagement of community influencers, the trusted faces, the faith leaders. A lot of support had to be garnered for this behavior change. Next slide, please. So this was, one of the earliest meetings I recall, when at that time the health secretary, Madam Preeti Sudan, had called a meeting of all the partners and said that this is what we are facing, a lot of stigma and discrimination in the communities, and I want all partners to come together and contribute. We are going to show the highest level of commitment and ownership, but we know we will not be able to do this alone, and we need a lot of support from other agencies and partners. And the Honorable Prime Minister, I think, making a very clear statement with the fact that the India's fight against Corona needed to be people-driven. So really, with putting the accountability towards every citizen, seeing that everyone had a role to play in terms of combating this disease and ensuring that support could be provided. We needed more kindness, compassion, messages that targeted the heart, messages that talked about sensitive communication, using the right vocabulary. While the government did its job, I think the partners on the ground, I also want to highlight very good work done by Sphere India in this aspect, bringing together a lot of humanitarian agencies quickly, supporting UN agencies was also very important and critical. Next slide, please. So as we know that whenever there is a new disease, there's a lot that influences how the community or the individuals really perceive the risk. And a lot of it is also decided by how the media is communicating. So the media also played a very important role in terms of engagement with media. I think union level and state level also did many activities. And public communication, as we know, will continue to play a very important role as the vaccine for COVID-19 gets rolled out to different beneficiaries one by one in a staggered manner. And we also knew that certain people who were at higher risk of severe outcomes of the disease, the elderly, those with comorbidities, also had to be made aware of the risk. The youth had to be made aware of how their behavior influenced the health of others in the household. And as we know how deeply rooted our societies are in religion, traditional beliefs, practices, cultural context, and its understanding also becomes very important, while the political and administrative structures dealt with the overall systems being put in place for testing, treatment, ensuring quarantine and isolation facilities, and the necessary wherewithal that was needed to respond to this particular pandemic. Next slide, please. So we know that while the ultimate goal of risk communication is behavior change, we really need to understand the what, why, and how to do it, because the local context will decide. And, the target population in each state has to be understood. What are some of the concerns? What are the motivating factors? What can compel? And which also means that there is a lot of listening to do. So risk communication does not have to be top driven. It has to be a bottoms up planning. One really needs to understand how the people are feeling, what are their concerns, what are some of their issues, and then feed it back into the targeted communication messaging. So this is what WHO tried to do to understand. We did a lot of perception surveys. We were working together with other partner agencies, UNICEF and other agencies, also to build in the necessary materials. Educating people with the right information is important, but also tackling misinformation is very important. And we know, and that there is now a lot of guidance from WHO website, which is available on as these states take forward their vaccination rollout campaigns on how to sustain the COVID appropriate behaviors, because as we know, even that is becoming an issue now. With cases becoming less, people feel that, the disease is no longer there, that they do not, even if they don't wear a mask or they don't follow social distancing, it's fine, but that is not the message that we need to give. So one has to reinforce all these COVID appropriate behaviors, that even after you take the vaccine, you still have to maintain the COVID appropriate behaviors. Next slide, please. Yes, so I talked about this. We can skip this. So in general, in terms of understanding what is the motivating factor for people to come forward and take the vaccine would also be very critical. Who are the trusted voices in the community who should be engaged with the government in promoting this kind of an advocacy and this kind of a response? What is the capability of a person to walk up to a COVID vaccination center and have the necessary tools and information to, to ensure that they take the necessary doses of the vaccine? Because as we know, as of now, the vaccines which are being rolled out are multi-dose. So I think all these factors need to be better understood as the vaccination program moves forward within the states. Next slide, please. So these pictures are from our recent visit to Gujarat, and Gujarat has recently concluded the review of its COVID-19 response in all of the 10 pillars, and one of the pillars is also risk communication and community engagement. So we also interviewed a number of stakeholders, and I think at every clinic, at every block, we need to understand what are some of the people who are not coming forward to take the vaccine, especially those at the front line, the doctors, the nurses, the frontline workers, Asha, Anganwadi, and other workers, because we know these are the very people who are going to be influencing others to come forward and take the vaccine, and also that their safety is the prerequisite in terms of understanding that the rest of the community should also come forward. So these issues are very important. At the time of the vaccination also, briefing needs to be done to every beneficiary on what the vaccine issues are, what could be possible, some of the minor side effects that could be seen. So all these issues are very important as we talk about risk communication. Next slide. So this is the Government of India communication strategy, which we were also partnered in terms of contributing, which has several pillars. I'm sure the state already has a copy and is working on it. So the states need to work in terms of advocacy, building the capacity of the different functionaries. And when we talk about capacity building, we also talk about capacity building of civil society and NGO partners as well. And we are almost near finalization of our knowledge pack, which will be ready for rollout for the civil society and frontline providers. So we also know that, as I said, the role of the media will continue to be important, but also social media, because a lot of information is going around in social media circles. Not all of it may be correct, but it does affect the trust and the confidence people have in the government's ability to deliver the vaccination, but also the safety and efficacy of the vaccination. So it is important that one also looks at crisis communication. So should there be an event around the vaccination itself, then the government should have a system of doing an immediate crisis communication response, addressing the factors around it, as well as ensuring that that trust is not eroded. As I said, social mobilization and community engagement will continue to be the driver in terms of handling COVID-19 vaccination, because let's not forget, India doesn't have, and most countries don't have experience in handling adult vaccination. This is perhaps a unique example in that sense, that we are having adults being vaccinated. And as it gets rolled out to those with other comorbid conditions, elderly citizens, and other folks as well, it will be important to establish that, the government is doing everything that's possible to ensure that the safety and efficacy data is made transparent, is made available to people. People understand what are some of the frequently asked questions. There should be a hotline set up if people have questions where they can come up and where they can seek more answers to their queries. So all these factors will be very important in terms of, the government needs to ensure that the right messages are given out. People at the front line should know what to say, what kind of questions people have in mind. So this really calls for a lot of engagement and listening, as I said. Next slide, please. So risk communication in that sense is a very layered context. One needs to understand the feelings of the population, the concerns, the anxiety. The knowledge needs to be assessed. What is the risk perception? We are currently planning for a nationwide survey, also in terms of understanding the knowledge and the risks around COVID-19, but also the vaccine. And also in terms of what is the media consumption, which are the sources of information that people in that particular communities trust, and then those should be leveraged to deliver the communication messaging. It is also important from time to time to understand how much of the population is actually adhering to the guidance which is given out. So all this calls for, active mechanisms set up for listening and, as I said, motivation, hesitancy, and drivers around the vaccine issues will really need to be understood as we move forward in the coming weeks and months. Next slide, please. Yes, and how can we not talk about the most marginalized and the most vulnerable people in the risk communication and community engagement response? So how do we reach the last mile, and how do we ensure that those that are really most vulnerable should be getting the sort of information that they need, the health access? And a lot of people actually in the beginning were hiding their symptoms because they were not comfortable coming forwards. There was a lot of fear and stigma around the disease itself. What will the other people say? What will my neighbors say? What will my family members say? I will have to. And we also saw in one of our perception surveys that people were very hesitant about different children being separated from their family members. So familial separation came out as a very big issue in the initial part of the pandemic. And also now, in terms of understanding, how do we reach the most vulnerable and the populations most at need for the COVID-19 vaccination would also be a very important part of our risk communication strategy. Next slide, please. So what has been the experience so far? We've understood that community engagement is not just sending out messages, leaflets, posters, TV advertisements and radio spots. This is about really working together, working closely, working to understand what is it that will really cause the behavior change at the field level. Next, please. Yes. So I'll stop with this slide. Just click both the buttons, please. So what we understand is we have to really use a mix of strategies and tactics. So not only public communication, media communication, but also social media communication, mass awareness, IEC, health promotion, social mobilization, where CSO and NGO partners have a very big role to play, interpersonal communication, how to motivate somebody who's hesitant, how to address the fears of somebody who is yet not clear about whether should go for the vaccination, what kind of messaging needs to be followed. Internal communication, very important. As I talked about, so many ministries coming together, so many agencies contributing, social and behavior change communication, but also reputation management. If there is a crisis that really happens, if there's a serious side effect, and suddenly, the whole vaccination program can get derailed if the crisis communication is not handled well. But also in terms of addressing all the stakeholders and partners and the political communication. It sends a very strong message down to the communities that here is our policymaker and he has gone ahead and taken the vaccine. So it must be safe, it must be efficacious. So I'll stop here, Hena. You can stop sharing my presentation. And I'll be happy to take any questions from the audience. And of course, thank you for the opportunity.
Thank you so much, Dr. Ritu. And we are we taking some sessions right now? Dr. Chauhan, you are with us for some time, right? So, in case you are not stepping out immediately and would want to be a part of some of the other subsequent sessions also, especially from UNICEF and then from the
Is
State Emergency
is
Operations
UNICEF
Center.
already online?
Yes, Dr. Saleem is here. We regret to inform that Dr. Vivek had to attend a very important meeting of the government, and we are being joined by Dr. Saleem, who is a health consultant of the state and representing UNICEF in the state of J&K. So we would request Dr. Saleem to kindly. Uh, we've already made him a co-host, and if he can please unmute him. And we also see few participants have raised their hands, but we would take all the queries after maybe one or two more sessions. After this, we have a session by Bilku, who will be giving a perspective of the JNK State Emergency Operations Center and giving us more insight into their work and their execution. After which, we'll be happy to take the questions and in an open discussion. Thank you.
Thank you, Hina, for giving me this opportunity to speak on behalf of Dr. Vivek, who could not attend because he had to attend some different meeting, important meeting. About me, as Hina has already said, that I am Dr. Saleem, working as a health consultant with UNICEF, and a very good afternoon to all of you from my side. I would like to say a few words, not that much. This is really a great opportunity for us as we stood together to face this deadly pandemic together. One more important thing is that it was a really a lifetime experience, and we may not see another pandemic in our lives. Fingers are crossed. But we must put down the foundation for our future generations, so that when they will hear about us, they will look about us, they will know about us, they must respect us, that they faced this pandemic with a healthy heart like a tiger's. So I just want to say something about this pandemic. Stepping into the year 2021 is not without burden of inheritance. During the first half of 2020, coronavirus rendered the entire human population speechless, motionless, and helpless. There was a time when every human being that existed on earth was looking into the skies for divine help to escape the assault of coronavirus. The bravery and the continued struggle by the COVID warriors did at times infuse hope, but most of the times the pandemic frightened most, if not all, from North Pole to South Pole. While the virus did not discriminate on the basis of race, religion, faith, may say caste or creed, or even status, the changes it brought on the globe essentially changed the world order. Life may not be same again as it is used to be prior to the pandemic. It is not only health that was under the severe threat, but also the education of the children, business ecosystem, and almost every sphere of life. It was certainly a threat to future of human existence. It exposed the weak public health system, the fragile disaster management mechanisms, complacency of governments, and lack of effective leadership in many countries. Some countries and its leadership emerged as torchbearers, not only protecting their population, but also showing the way to the rest of the world, thus emerging as tigers, what I said earlier. Governments of some countries could not give enough protection to this disadvantaged and vulnerable sections of the society. The story of pain, agony, and suffering of weaker section, what was initially said by Amir sir, society was pathetic. Migrant workers, daily wagers, manual workers, and informal workers were left to fend for themselves. Hundreds of thousands had to walk over 400 kilometers to reach their homes in rural areas, somewhere in Bihar, in UP, as they had no job or a source of income in lockdown metropolitan cities. But most of them showing courage to fight back through penniless with nothing in hand is a real trump worth description. They won half of the battle there only. Virus not only reached individuals, they reached the regions like angels where the angels could not reach, the virus reached those areas. Scientists and researchers were in the race to find out cure. Even we have now a vaccine in hand. There are many brands of vaccines in hand. Diagnostics and therapeutic tools, a potent drug or an effective and a safe vaccine. These were the scientists were looking for these things. Experiments to reach the goalpost were not that easy. So I'm just describing the tough time we had over the last 1.5 years in the search of these effective diagnostic and therapeutic tools. Experiments to reach the goalpost were not that easy. There was not any breakthrough in discovering a drug, and not nor was a vaccine made available to the entire human population. Now it's available, I can say. It also raised more questions as answers of scientific scrutiny. On individual basis, humans face struggles for existence and survival of the fittest. Many lost hopes, and many more awaited a divine interpretation to see the virus vanish. It left scars on the human psyche, more so on the children and young adults who lost nearly a year without going to educational institutes, play fields, amusement parks, shopping malls, restaurants, or paying a visit to pay condolences to the bereaved or attending a marriage ceremony. Was everything lost, including hope, I can say. Moreover, lastly, I could, on a conclusion, I will say the coronavirus pandemic is a critical, unlike any in the world during the last 80 years of history. COVID-19 is a fast evolving pandemic, and COVID-19 is emerging as a major public health threat, leading to a global crisis that is unprecedented and extraordinary. The pandemic has revealed the need to manufacture health commodities and strengthen supply chains closer to where materials are needed domestically and globally. The pandemic reminds world leaders that underinvestment in public health of one country is a threat to global health security everywhere. If we get the good governance, we will be successful in the global response to future pandemics and achieving global health security for the future. Thank you so much. Hina?
Yeah. Thank you so much, Dr. Saleem. Gohar, would you like to introduce our next speaker?
Sure, ma'am.
Bilkis is joining. So Dr. Gupta had to step out to attend another meeting. So yeah.
Is Professor Anil available, ma'am?
Not really. He had to attend a meeting of the Ministry of Environment. So he had to step out. Yeah. So we will be calling now and inviting Bilkis to share her perspective in terms of sharing some of the work that SEOC has been into and giving a crux of the session today also. Yeah. Yeah, Gohar?
Yes, now I am privileged to call Ms. Bilkis, Consultant Disaster Management for Roadmap Ahead, and say a few words.
Hello everyone, this is Bilkis. Thank you so much, Gawar and Dr. Hina, for making me a part of this gathering and this wonderful event. I'm very happy that we have finally launched our COVID Academy and we are successful with that. I may not take much time and I'll start talking about certain things that SEOC has been doing. Uh, uh, with respect to the collaboration with Spare India, it has been always wonderful to work with them. And initiative of IAGs that has been, started by Spare India is something that we are going to take up in future. And we are in the process of strengthening those IAGs and also in a process of strengthening the coordination and the collaboration with multiple stakeholders of disaster management. Uh, yes, with respect to the COVID Academy, that I would like to say that this COVID Academy is actually a wonderful step that Spare India has taken, and it's something that's commendable. And for us, as a consultant to the disaster management department and with certain districts as the trust areas, we are going to use this as the state of art document for documentation of the casualties during the other disasters as well, and it will definitely be used to actually create the awareness and destigmatization of the stigmas that those are related to the pandemic. And yes, these lessons that we learned during COVID will be used in future also. But I like to emphasize on one thing, that is the IAG, that's interagency coordination, interagency group, and strengthening about that. We have had certain collaboration meetings with Sphere India, with Dr. Hina, with Gauhar and other members of Sphere, and also we have had meetings with the few NGOs who are, I just want to say that people who we reach to are really enthusiastic to kind of be a part of it. So we have started with it like this, that we are going to have a joint action plan, probably in our districts, where we are actually working, and we may start with one of the districts, and we may bring all the activate NGOs and CSOs who are working in the district on a common platform, wherein we'll share about we have asked the districts to get us the list of the active NGOs and CSOs who, with their names and with their mandate and core specializations, and in order to bring them on a common platform and actually have an directory of such organizations in our plan. And also, while planning for the trainings in our districts, we have started and discussed with our ADCs that we will definitely bringing in all the agencies as per their specializations in our training schedules, and they'll be made a part of our initiatives that we are going to take. And in future, we are definitely going to take these organizations into consultation while planning or while training of the community. And yes, the community engagement will definitely be taken care of in consultation with the organization and other stakeholders. And yes, our mandate and our focus will be in strengthening the IAGs, and inshallah, we are looking for better response from all the government agencies, and as well as the non-governmental agencies that will come forward, and we'll definitely have we'll start with the table, you know maybe we'll start with a meeting wherein we can at least share our mandates and core specialization, then we can go ahead. uh, Once again, I just want to say that I am in this gathering wherein I have people who are actually, extremely enthusiastic in working in the field. For example, we have certain NGOs who have already laid their hand, lent their hand to us. And for example, there is Mr. Mustafa who is working with the Prayas, and they have already, they came to us with their plans and programs, and we are kind of collaborating with them. And in the same way, we'll collaborate with other organizations as well. And we have wonderful officers here who are really supportive in launching any kind of such kind of a program. And yes, we, being a part of the State Emergency Operations Center, will always be and will always try to be a part of the collaboration exercises and coordination exercises. Thank you, Dr. Hina. Thank you, Gahar, for making me a part of it. And this is all I would like to say. Thank you so much.
Thank you, Bilkis. Thank you so much. Really, role of GeoNGO coordination in disaster preparedness and response plays a prominent role, and we should look for that as well. And like you rightly said, that the interagency group coordination is the need of the hour, and we hope the collaboration and support from all the stakeholders that are on board. Uh, Ma'am, shall we Shall we go for vote of thanks, ma'am?
Before that, we would want to hear from our government counterparts who are here and our NGO and civil society participants who have joined us for this very interesting session. We highly regret the inconvenience caused at the start because of certain technological snarls, which sometimes become unavoidable. We highly regret that, but we would like to open this a little in terms of some of the questions that may be cropping in the participants' minds. It can be, since we have the government officials here and some of the civil society organization participants representation here, so there may be many questions looming very large in in our mind in terms of capacity building, how to proceed forward, what are the communication strategies, do we want to know more about that, what are the issues and concerns that we would want the COVID Academy to highlight on, how are we ensuring the vaccines are safe, who is doing the monitoring, so a lot of questions on equity, which CSO representatives have been flagging in other parts of the country, right? So just some small or no, any submissions, any insights, any suggestions, any comments, or any queries are most welcome. You can please raise your hands, and we will be happy to register your queries. In case we can answer them right away, we'll be happy to do so. We also have Amir sir here and some of the other technical experts also with us. In case we are not able to answer your queries, we'll come back to you again with detailed detailing of the answers. If we can open this for some of the questions, we had requested if some of the people can post their queries on the chat box also, so they will also come in our notice. This is the first Geo NGO interface that we are creating after a very long time, and it's very heartening to see. And a lot of Amir sir's support. I look upon Amir sir as an institute in disaster management in the state of J&K, and thanks to his leadership in bringing all of the relevant stakeholders together in this very important platform, but would want to hear from your side also, so that makes it very participatory and very interactive. So would appreciate, encourage to hear from any of you. You can please raise your hands and we can take your queries one at a time. Somebody has raised their hand. Yeah, Ratib. If we can please unmute Ratib.
Ratibul Zahir, please unmute yourself to ask question.
No, somebody. Yeah, Ratib.
Greetings to all the participants of this web conference. As far as communication strategies are concerned, what the government is portraying to for public, it has been learned that through the different mediums that most of the government functionaries, they are not adhering the proper SOPs for the COVID-19. Like some of the officials are not using masks properly. They are roaming after, and as Dr. Ritu Kalleri mentioned that SOP is still there after if someone is immunized. I mean, if someone has been vaccinated, still they have to adhere the precautions. But what the people are learning from the different mediums of the mass communication, it is total mass in the administration. Almost of the people, even some of the chairmen of the district disaster authorities, are visible without masks in the almost public meetings. But I would like to congratulate Mr. Amir Ali sir, who is always been seen with adhering proper protocol of the and SOPs of the COVID-19. And as I was also watching I have also watched almost webinars of in the initial stage of COVID-19 breakout in whole the country and in the UT of Jammu and Kashmir as well. But people, government functionaries, they need to adhere the precautions that, particularly at that time when they are disseminating something to the public, when they are, which is particularly when they are participating in a meeting and it's necessary to disseminate the proceedings of the meeting for public, they need to be in proper use of masks and other social distancing norms, etc. As the president of the country of our country is always being witnessed with the using proper messages, our Prime Minister, our Lieutenant Governor, our Chief Secretary. But some of the government functionaries, they are totally messed up. They are not adhering the COVID protocol properly.
Thank you so much, Ratib. I think some of your things were submissions, and you have thanks for reinforcing the fact that we need to continue the COVID appropriate behaviors. And you've also posed in some challenges vis-a-vis dissemination of the SOPs. If we have health experts in this group, Dr. Saleem, do you want to respond to that? To that part, and also on the communication strategies employed in the state, if we have guidelines and whether they are rolled out. Dr. Saleem, are you there? Okay, we have taken note of your submissions and your suggestions and some of your queries also, and we would get back to you with the responses of your queries, Ratib. Thank you so much.
Thank you so much.
Any other suggestions?
Do we have any more questions from the participants, please? Any suggestion?
Danish, you want to come in with any of your insights? See some of the colleagues whom I've worked with. So, yeah, Danish. Okay. Amir sir, do we want to listen to some of the perspectives from the government before
Danish
we
wants
close?
to speak up.
Yeah.
I'll make him give him the rights once.
Amir sir, yeah. Kindly unmute Amir sir.
Danish wants to speak up. You were
Yeah.
calling.
Yeah.
No, sorry, I didn't know I have to speak up. Good afternoon, everyone. Sorry,
Yeah.
I was unable to unmute myself when you were calling out my name. Yeah, sorry, Henna, can you go again?
So Danish, I was just saying that if you can share some of your responses to this launch event of the COVID Academy and some of your insights on how we can proceed ahead, keeping in view the IAG also and now the government counterparts, and working closely, and how we can complement, supplement each other.
Yeah, sure. I think it was quite high time that we had this, and I've been closely associated with Sphere for quite some time, and I admire the work, especially if I talk about the coordination that Sphere has been doing, the kind of knowledge management that's been done, and especially during COVID. I myself was part of one or two sessions which I really said, which I feel that we had done one on a continuity of learning, and especially I think it had a J&K kind of angle to it as well. We shared experiences from J&K on how the Department of School Education is talking about education continuity. So first of all, I can congratulate the entire Sphere team, specifically you, for bringing this. I think it's very good that J&K has its own chapter. Secondly, I think how can we coordinate? I mean, I look after education, but also have my really interests in education and emergencies. I've been part of the DRR fraternity for quite some time myself, and I think how we can really support is, of course, the IAG. It has its own relevance. I also convene a network of NGOs. Which is called the J&K Pi Network, Partners in Education, specifically organizations working with in the education sphere, which has some of the top names from J&K, if you might say. We've got Pratham, Kevale, Chinar, JKSW, Alpha International, and we've got Hope, and just to name a few, some of the most organized. So I think specific sessions, I mean, if it concerns education, I'd be very happy to lend my sort of support. Another very good collaborative, which I'd like to speak about, is the Samagra Shiksha department. The Directorate of Samagra Shiksha has its own ICT platform, which is called the JK Knowledge Network. I think it's a very useful platform. I've been trying to also kind of revive it rather, or you could say in a way, use it as a platform to reach out to teachers, students specifically, of course, with sessions regarding education only, but also it has some very, I think, relevant. We've had some very relevant we've talked of relevant issues like, mental health, psychosocial support. We've talked of child protection, COVID SOPs. So we try and organize different sessions each time. Also, more specific to school education as well. So I think that could also, be a good platform. I'm thinking it would also help us to reach out to as many, because you see, we have a cadre of say about 1.5 lakh teachers, and they are one of the best agents to reach out. I mean, if we are looking at the benefit of children, to reach out to most number of children, so the best agents for us to reach out through is teachers. And I think COVID has also kind of brought a lot of them online. The role of edtech has been really highlighted. So I think that these are the few things that I would say from my end could be suggestive, could be done here. It's working really well, and it can be continued and maybe taken on. I think also another platform, if I may share, is about the UniLearn platform. I mean, it's something like, if some of you are familiar with the Agora platform, which is like UNICEF's training platform. It's something on a similar line like a Moodle. We are still testing it out, but it could also prove to be very useful if you want to have specific, if you want to develop specific course content, park it out there and get participants to do certified courses. I could also walk you through that, and we'd be very happy to collaborate on that. So that's all from my end. A few, just handy tips.
Thank you, Danish. I think it is quite heartening to learn about the various networks that you, as an education expert who is working in the state, representing UNICEF, largely working on education aspects. You've mentioned quite a few networks, the Pi network, the UniLearn, and some of the other engagements that you've had. And it's quite encouraging to know that you are making your own working technical groups vis-a-vis education, working primarily on education aspects, child protection aspects. Quite encouraging to learn about it. And there should also be a forum and a platform to also inform about the various geo-NGO coordination meetings that SPARE is also planning to organize in consultation with the Divisional Disaster Management Authority and the State Emergency Operations Center. And maybe we rope in IMPA also, Institute of Management and Public Administration. We've recently had a round with the faculty members there in terms of understanding how we can work under one umbrella, naming it as a geo-NGO platform. So while you are specifying your platforms, I was thinking of the probability of having these small working groups, technical groups, working under a large platform of a geo-NGO coordination, which can work in consultation with the state ATI and maybe the disaster management division also of the state. So we have to kind of take some baby steps to achieve some of the things that we are envisioning here. But of course, for the working group, we're certainly going to plan these geo-NGO coordination meetings for health, WASH, and food nutrition security in the 2nd and 3rd week of March with support of the Divisional Disaster Management Authority. And we will keep this network and this group also informed about it. We would want more and more of geo as well as NGO participants to be a part of this forum. And we'll call out a working group after each of them and do some action planning, maybe to take up some of the issues, concerns, and devise a plan of action for each of the sectors. That's how we've been doing in other parts of India as well. just to quote the Maharashtra, we are planning to get into a tri-party agreement with Yeshada, which is a state ATI, with UNICEF, and of course the health department and the other government departments in Maharashtra. Now, Maharashtra has been a state which has been very affected by this pandemic, and we also have a similar network called the PicoNet network, which has participation and board membership both from government as well as the civil society and the UN agencies, and that is going to be a knowledge forum which is going to and right now it's still in the embryonic phase, and we are devising some and formulating some methods of jointly, collectively working together with the government, so that civil society and there are synergies, there is convergence, there is integration. So all of these aspects are really very important. So Amir sir, I'll hand it over to you for your final comments and your final summary of this session and the way forward. Maybe can please unmute Amir sir.
He is the host. He can do it himself. Amir sir, you there?
Are you available, sir? Amir sir? Can you unmute yourself, sir?
I'm trying to do it. He might be getting a pop-up on his screen.
Amir sir, we're not able to hear you. Probably are encountering any difficulties. Kindly put your
Probably he was traveling.
box. Maybe he is facing some issues with the audio.
Amir sir, are you available?
Okay, Gohar, I think there are some issues with the audio. That's why Amir sir is not able to address. So can we, in case there are any other urgent questions coming in from the audience participants? Otherwise, we will close with a vote of thanks.
Any suggestions from the participants or any questions you have?
So let us have a quick vote of thanks now. Then go ahead.
Okay, ma'am. Thank you. Thank you so much. So, firstly, I regret the inconvenience that was caused during the session due to some, technological challenge. As you all know, that it's about technology, either it's bad or good. It's just about usage. But we highly regret the inconvenience, especially to Dr. Ritu ma'am. We highly apologize for the inconvenience that was caused during the session. Now, let me propose the vote of thanks, and it's my privilege to have been asked to propose a vote of thanks on this occasion. I wish to express my sincere gratitude to Shri Panduram K. Pole, Divisional Commissioner Kashmir, for sparing his precious time for his busy schedule and providing encouragement and support to all of us in the inaugural session. We really appreciate, although sir was not present, but the representative from the Divisional Commissioner's office, that is Additional Commissioner Kashmir, Mr. Bilal Ahmed Parsaf, who were present and shared, kind words with us. I also extend my thanks to Mr. Engineer Amir Ali, Director Disaster Management, Nodal Officer, Jammu and Kashmir State Emergency Operations Center, Srinagar, for his enormous cooperation and support in organizing this webinar. Sir, we feel honored by your presence and hope your cooperation and support in future as well. I wish to express my gratitude to Dr. Hina Hijazi, Senior Manager Programs Super India, for gracing the occasion with her kind words and also for guidance and support for planning and organizing this webinar. I must mention our deep sense of appreciation to Dr. Saleem from the UNICEF for his kind words, and Dr. Ritu ma'am, Dr. Ritu Singh Chauhan, National Professional Officer, World Health Organization, Ms. Bilkis Dar, Consultant Disaster Management, for their presence to enlighten the participants by their vast knowledge and experience. I also extend my thanks to the team Sphere India, especially Ms. Shivangani, Mr. Vijesh, Mr. Anil, Mr. Matthew, Mr. Komali, Mr. Nitin, and Mr. Sejilo, if I'm able to pronounce it right, for their professional support and making this event a success. I thank all the participants for their valuable presence and staying with us during the session. And download the participation certificates from the official website of Sphere India after 24 hours. And lastly, on behalf of Jammu and Kashmir State Emergency Operations Center, Divisional Disaster Management Authority Kashmir, and Sphere India, I wish all of you a happy and safe living. We hope to see you in our future sessions soon. Stay healthy, stay safe. Thank you.
Thank you, Gohar. Thank you, Dr. Hina. I'm sorry I got disconnected for a while.
Most welcome.
Excellent, and it's been a wonderful session, though we had a few hiccups in between, but nevertheless, we have been able to launch the COVID Academy today and hold this very important webinar. And I hope that we organize more future programs with Sphere India. And inshallah, you'll get all our cooperation in future also. Thank you very much.
Thank you. Thank you so much, Amir sir. A very special thanks to you and to the Divisional Disaster Management Authority, and not forgetting Gohar, who has been the driver behind this, coordinating and doing a lot of back-end work. Thank you so much, Gohar, to you as well. And thanks to all the participants who joined us for this very initial session. And there are going to be many more. Thank you so much, everybody, for joining us and staying with us through this interesting session. Thank you all once again. Khudafiz, Assalamu alaikum.
Ask Mr. Nitin to end the session, please.